Hi, my name is Twanda Kelly. I'm a nurse. I'm here to nurse practitioner student. I'm here to do your physical exam. Could you please tell me your full name and date of birth?
My name is Olivia Kelly, and I was born May 6th.
Alrighty. Okay, do you have any pain today?
No pain.
I'm going to ask you some questions. Don't be offended, but I have to ask them anyway. Do you want to hurt yourself?
No.
Do you want to hurt other people?
No, I don't.
So Olivia's not suicidal or homicidal. Do you know where you are?
Yes.
Where are you?
I'm in a clinic.
Okay. Who is our president?
Joe Biden.
Alrighty. Who's the last president?
Donald Trump.
Okay, thank you. So the first thing we are going to do is we're going to notate your head symmetry. We're going to look at Olivia's head and face. Her face is symmetrical. There's no drooping of her lid. There's no abnormal eye movement. Her skin on her face and head are without bruises or any scratches. There is no involuntary eye movement. Can you raise your eyebrows? Can you smile for me? Frown for me? Puff out your cheeks? Alrighty. So we're gonna look at this eye chart that's behind me. I tell you what here, just read the lowest line on this paper. Just read any line on the lowest line.
Eyes.
Okay. Cover up one eye. Tell me how many fingers I'm holding up.
2. 1. 2. 3.
Okay, so you're going to follow the top of my pen here. We're going to test your extraocular eye movement. Just follow with your eyes and not with your head. Alrighty. Cranial nerve number 8 is intact. Cranial nerve number 7 is intact. Okay, so we're going to look at your hair and scalp. Olivia has a full head of hair. She does not have any baldness or scales or any abrasions. So now I will have you to to tell me where I'm touching you, if this is hard or soft, okay? We're going to check for hardness and softness. Okay? Alrighty. So, sensory loss. So I'm going to palpate your temporal, masseter, and muscles. So I'm going to palpate your temporal sinuses. Just tell me if you have any tenderness. Her trachea is midline. Any sense? Yeah. Huh? Yes, I did conduct my hand hygiene. I'll do it again since I touched your face. Any tenderness? Any tenderness? So I've already palpated your cervical lymph nodes. There's no, and your trachea is midline. So I'm going to go around behind you and check your thyroid.
Oh wait, were you asking me if I felt tenderness?
Yes, I was.
Oh no, I felt no tenderness.
Okay, no tenderness. Okay, I checked your thyroid. Okay, we did visual acuity. There's no protrusion or no deviation of your eyes. Eyebrows are symmetrical and full. No scaliness. Eyelids and eyelashes are within normal limits. No baldness or anything. Take off your glasses for me. Her conjunctiva and the color of her eyes is brown. Corneas are fine. So I'm going to look in your eyes. in your ears while, oh my goodness gracious. Eyes and ears while I have you here. Okay. I'm just gonna look in your ears. Okay. Now we're going to check for her eyes. We're going to look at her eyes, the way that the shape of her eyes, her eyebrows, the overall color of her eyes, looking at her eyelashes. Looking at her eyelashes, I inspected her eyebrows for fullness. Her eyelids, I looked at those. Her eyelashes, the color of her eyes, brown. Close your eyes, please. Open them. And I inspect her conjunctiva and her sclera. Also, I inspected her cornea, iris, and the shape of her pupils. Also, I'm going to look at the light reflection on her eyes and test her extraocular movement. So what I want you to do when I test that, I am going to turn this light on. Now, I am going to have you to look at this chart. It's a Snelling chart. Hold it on arm's length away from you, not towards the camera, please. And then you can read. I will have her to read the Snelling chart. Also, I'm going to have you to cover your right eye with the paper. Cover your right eye with the paper, please. All right, so we're going to check, one moment. We're going to check her pupils. All right, move forward to me, please. So I probably should have turned off the light, but we'll be fine. All right, so I'm gonna come in and open your eyes, open your left eye wide for me. No, look at me, directly at me. Look at me, cover this eye, hold your head down. So I just want to look at her eyes, checking her pupils. Perfect. Now, cover the other eye. Look directly at me, please. No, look at me, please. Wonderful. Okay, now you can take that. Eyes are equal round and reactive to light and accommodation. She has no swelling of her iris or her lens. Her cranial number 2 and 3 are intact. Extraocular eye movement, her ears are fine. I'm going to say 2 syllables. Repeat after me.
Donuts.
Okay.
Hairball.
Alrighty. Her pituitary is intact. Her tympanic membrane is gray with no bulges, no redness, no wax, no tenderness of the surrounding tissue. Let's see. Let's look up in your nostrils. I should have did that when I had this out. Okay. Nostrils are pink and moist. No bleeding nostrils. We've already did the sense of smell. Maxillary sinuses. Sinuses were palpated and non-tender. Let's take a look at your mouth. Open your mouth. Stick out your tongue. Oh, hold your head up, please. Oh, no, I need you to relax your tongue. Alrighty. Hypoglossal, cranial nerve number 12 is intact. Alrighty. There's no scaling, no cracking. All mucosa is white, pink and moist. Gingival, no missing teeth, no misshapen teeth. Her hard palate is intact. Her tongue movement. Stick out your tongue. She's been eating candy. Hold your tongue up, to the left, to the right, up inside your mouth. Thank you. Cranial nerve number 12 is intact. And she was able to swallow when I saw her uvula. Her speech is articulate. She has no involuntary movement. Her sternocleidomastoid, let's see. Hold up, please. Does that tickle? Okay, intact. So, we're going to do the extend your arms, and then you're going to touch your nose. Alrighty. So next thing I'm going to do is use my stethoscope and listen to your lungs. Okay, you can stop doing that. Stop doing that. Take a deep breath. Blow out. Blow out. Take a deep breath. Blow out. Deep breath. Every time the stethoscope touch you, take a deep breath. Lungs are clear to auscultation. I'm listening to the back. Okay. I'm going to listen to her heart sounds. Dub. S1, S2. No murmurs. Okay, you're going to lay down. I'm going to listen to your belly. Lay down for me, please. Lay down. Okay. Sit up for me. Don't palpate over breast tissue because patients will not like that. Breast sounds are present to all four quadrants. So I need you to do some finger tapping, please. Finger tapping, please. Awesome, awesome. So you're gonna put your hands on your palms. Awesome, awesome. So I'm going to check your reflexes. Okay. Okay. Prevent me from bringing your fingers together. Okay, now close up. Prevent me from bringing them apart, okay? Let the patient's arm dangle. Okay. Like this. Like this. Like this. Alright, then push them up. Hold your arms up like you're gonna fight. Like this. Prevent me from bringing them forward. Prevent me from pushing them. Okay. Toes down. Up. Okay. Rotate your ankles. Okay. Okay, relax. Your toes will go up. Okay. Okay. Prevent me from pushing your leg down. Okay. Okay, you gotta get up and walk over there. Okay, walk straight back. Okay, so you're gonna walk from here to there on your tippy toes. Now walk back on your heels. Alrighty. Okay, you can get back on the bed. Alrighty, let's do your shoulders. Raise your shoulders up. Alrighty. No swelling. Her elbows are, she's able to extend her elbows. There's no swelling or nodules. She can rotate both wrists, shoulders, flexion and extension. So you're gonna do your shoulder like this, out like this, and in like this. Next one. Any pain? Bring it in. Alrighty. Stand up. I'm gonna take a look at your spine. Bend over, touch your toes. Bend over, touch your toes. Spine is midline. Do you have any pain when you do that? No? Do your hips from side to side. Any pain?
No.
Now you're gonna do your range of motion, hip flexion and extension, abduction and adduction. So bring your knee out like this. Right sapling. Right leg out. Bring it back in. Next one. Alrighty, any pain or discomfort?
No.
Alrighty, well thank you, Miss Olivia. I greatly appreciate your time. Do you have any questions?
No.
Bring your knees up, flex your knees for me. Next one. Alrighty. Any pain or discomfort?
No.
Alrighty. Thank you, Miss Olivia. Hi, my name is Tawanda Kelly. I'm a nurse practitioner student. I am here to do a head to toe assessment. Could you please give me your name and date of birth?
My name is Olivia Kelly, and I was born on May 6th.
Thank you. Could you tell me what day it is?
It is currently Monday.
And what day and month a year and year is it?
Day, month, and year.
Yes.
It is the year 2023. It is the month of November, and I believe it is the 27th.
Yes, that's correct. Who is our president?
Joe Biden.
That's correct. Who was our president before Joe Biden?
Donald J. Trump.
Yes, that is correct. Thank you. So we have established that Olivia is alert and oriented to person, place. Where are you now?
I'm currently in my home.
Thank you. So Olivia is alert and oriented to person, place, and situation and time. So we're going to look at Olivia's face. Her face is symmetrical. She has no lid drooping, no abnormal eye movement. And she can smile for me, frown for me. Smile, show me your teeth. Puff out your cheeks. Okay, we've assessed cranial nerve number 7. Alrighty. So we've already looked at Olivia's skin on her head and face. We looked at her hair. She has no balding. She has a great head of hair. Her face is symmetrical. I've already conducted my hand hygiene. No lumps, no bruises, no bumps. Her head is shaped round. No trauma to her face or head or anything, no hair loss. No scaliness or lesions. So I'm going to palpate her cervical, lymph nodes, frontal sinuses, and maxillary sinuses. So I'm going to be touching you under your ears and cheeks, okay? And what I'm checking for is any swelling of her lymph nodes or tenderness. So we're gonna palpate her frontal sinuses and maxillary sinuses. Any tenderness?
No.
Thank you. Alrighty, so we've already taken a look at her eyes. So I'll have you to read something. Just tell me the smallest line that you can read, please.
Shansen Guangdong.
Thank you. So she's reading the company name on the box. Thank you. Do you have any pain or discomfort?
No.
Okay. So we're going to check. We've already tested cranial nerve number 2, the optic nerve. She has no protrusion or deviation of her eyes. Her eyebrows are full and the hair on her eyes and eyebrows is full and equally distributed. She has no pink eye. Her corneas are equal. So we're going to check her pupils. Okay, we're going to inspect her pupils. So, can you tell me how many fingers I'm holding up?
2. 1. 2. 1. 2. 1. 2. 1.
Okay, look at my finger. All right, thank you. All right. Symmetrical. So we checked her pupils. So we will check your hearing. I am going to whisper a 2-syllable word. You tell me what I'm saying.
Donut.
Awesome.
Hot dog.
Awesome. Alrighty, so next thing we're going to check, we're going to look inside your ears. Excuse me. And we're going to look at your retina and red reflex. Okay. Oh, you've already did that, so we'll just edit that in. So we're going to look up, where's your phone? Do you have your phone? I don't have a flashlight. My flashlight broke. Okay. So, can you kindly remove your glasses? So I'm just gonna open your eyes wide. I don't have a otoscope. We've already did that once. So we're gonna check inside your ears. Alrighty. We're gonna check on this side. Okay, no wax. No bulging eardrums. Tympanic membrane is pearly gray. So we will do your sense of smell, cranial nerve, number, oh, excuse me, 1, olfactory. Cover up one nostril, please. Do you smell anything?
Yes.
What?
Vanilla?
Not quite. It's an extract, but it's not vanilla. Okay. Cover up your other nostril is banana.
Coffee.
Yes. Let's do the other nostril. Snoop. Can you smell anything?
No.
Okay, you probably have a cold on that side. That's cinnamon. So we checked your olfactory nerve. You're having difficulty smelling out of the right nostril. I think you have some, but you did smell the bananas. So looking at your mouth, there's no cracks. Your mouth is warm, pink and moist. So I'm going to have you to open your mouth and I'm going to take a look inside. Open your mouth for me. Hold your head up some. Say ah. Thank you. So your lips are nice and pink and moist inside your throat. You're able to say ah. I've inspected your roof of your mouth. There's no redness, no sores, no fasciculation. We've already had you to puff out your cheeks, checking hypoglossal. Let's check your swallowing. So what I'm going to do is I am going to look at your trachea and then I'm going to gently touch your trachea. You're going to swallow for me. Okay, trachea is midline, swallow for me. Alrighty. No difficulty swallowing, right?
No difficulty.
Okay, we took a look at your uvula movement. That was fine. Her speech is clear. Even stats, cranial nerve number 5, 7, 10, and 12. So we will do your neural. We're going to check for muscle strength and tone. So I'm going to take a look at your trapezius and sternocleidomastoid muscles. shoulders for me. Thank you. Sit up. Okay, I'm gonna turn you around. So I'm not gonna have you, do you mind if I lift your shirt?
Yes, I do mind.
Okay, so I won't lift your shirt. So here, it's gonna clear my story. Any tenderness, we check your thyroid. That's fine. This is fine, like this. No tenderness?
No.
Okay.
Was that in frame?
Was it what?
In frame?
I believe so. Excuse me. So we're gonna look at your muscles. Can you hold? Can you do like this for me? Tightly make a muscle. So she has no involuntary muscle movements. Can you flex your arm down like this?
This isn't frame, right?
Yes, it is. On the other side, please. Point your fingers down, point your fingers up, rotate your wrist, rotate your elbows, and rotate your shoulders. Thank you. So what I'm going to do is I'm going to come back over in front of you, hold your arms up like you're going to box, like so. So what you're going to do is prevent me from pulling your arms towards me. Okay? Prevent me from pulling, prevent me from pushing. All righty, thank you. Okay. Excuse me. So we already did flexion and extension of your wrist. May I? So I'll do like this and extend. Does this hurt?
No.
Let's do this side. So we gotta do this. Flexion and extension. Okay. Yeah, you got strength here. Alrighty. This one. Equal strength. Thank goodness. Alrighty. So we've already assessed your gait. Let's do that again. Can you get up and you're going to walk to the end over there on your tippy toes and come back on your heels. Thank you. So we're gonna do extension of your legs. I'm gonna turn you this way. So we're gonna check the strength in your legs. So what I'm gonna do is I'm going to, let me make sure you're in frame. No. Okay, so what's gonna happen is, you're gonna prevent me from pulling your legs out that way. Then you're gonna prevent me from pushing your legs in that way, okay? So, okay, and let them relax and prevent me from pushing them. Now, put it down. Now, yeah, do that. All righty, good, good, good. You're gonna turn around and you're gonna do like this. Thank you. All right, let's make sure you're in frame. Awesome, you are. Okay. So we did bicep reflex, tricep reflex, brachial, radialis, quadricep. Point your toes down. One moment, you're out of frame. Point your toes down. That's plantar flexion, pronation. Point your toes up to the ceiling. Thank you. Look up at the ceiling with your head. Look down. Touch your chin to your neck. Your chest. Does it hurt?
No.
No? Okay. Alright. So I'm going to listen to your carotid and your trachea while I'm over there. I did not do that. Oh, good Lord. So I'm going to palpate your carotid one at a time. No grits. Hold your head up. Trachea's midline. Hold your head straight for me. That's no noise. You've already inspected your ankles, your feet. Stand up for me, please. We're gonna look. We already looked at your spine. Twist at the waist. Thank you. Turn around to the back. Twist. Alrighty. Thank you. You've already inspected your elbows and your shoulders. Okay. I think that's good.